Medication management for patients and caregivers. So today we're going to module 4. And just as a reminder, this is brought to you by my web pharmacist. So it's a community where we help people prevent injuries and pain caused by improper medication intake, therefore allowing more energy, mobility, and wellness. So today we're going to module 4. And the presenter is Dr. Olufemi Williams, a pharmacist. Who is this course for? Patients, caregivers, and family members. And the course format is online video lessons, downloadable guides, and there will be a self assessment at the end of the course. What are the course objectives? Empower patients and caregivers to safely manage medications, improve understanding of medication use and adherence, build skills to prevent medication errors and manage side effects, promote active participation in healthcare decisions. So, we've already covered module 1, 2, and 3, and now we are going to module 4. Module 4 is medication adherence, taking medications the right way. What are the learning outcomes for this module? It's understand the importance of taking medications as prescribed, identify common barriers to adherence, and learn how to overcome them. And we're going to be having 4 topics. That will be why it's important to take medications on time and as directed, what happens if you miss a dose or stop a medication too soon, overcoming common barriers, forgetfulness, cost, and side effects, and tips for caregivers supporting a loved one's medication routine. Now, of course, it's just going to be an overview because we could spend a lot of time on each of those topics, but we'll just do a brief overview. So, why is it important to take medications as directed? It ensures the treatment works as intended, prevents disease progression or complications, reduces the risk of hospitalizations or additional medications. You know, when the doctor prescribes a medication and says you should take it till it's finished, there's a reason. When they say, oh, you're going to take this all the time, there's a reason. So it is very important that you take medications as directed. Later on, further down in the course, we'd like to go over some topics like what are the lifestyle hacks? Are you doomed to take these medications for life? It depends. It depends on what your health condition is. But we'll talk about life hacks that can help us reduce the needs for medications. But as long as you're taking medications now, it's important that you take them exactly as directed by your doctor, your prescriber, or your pharmacist. So, what happens if you miss a dose or stop a medication? So, depending on what the medication is, because as I told you, this is just a brief overview, there's so many different scenarios. If you're taking an antibiotic, you want to take it till you complete the dose. Even if you start feeling better, you still complete the dose so that it will not lead to bacterial resistance. When you start taking your antibiotic, it starts killing the bacteria, and so you begin to feel well because the bacterial load is low and your body starts healing itself. However, if you stop it too soon, some of the bacteria that did not get killed or some that were just injured will start replicating and getting stronger. They've already known how the antibiotic works, and when they are replicating, they will start designing themselves to be able to resist that antibiotic next time you use it. So now, instead of you killing off the whole bacteria, you now left some to survive. And when they come back stronger. So that's how you develop bacterial resistance. So next time, that same bacteria now has produced in millions and comes back. When you go back to that same antibiotic that worked before, it will not work because the new bacteria that has been formed is stronger, has developed itself to be strong and resistant to that medication. So the doctor will have to look for a different kind of antibiotic. And if you keep on doing that, you now develop a super bacteria that is resistant to so many medications. So that is why when they tell you take it for 5 days or take it for 10 days, you should do that because even if after the second or third day you feel better, you should still complete your dose. Now, if you miss a dose, let's say it's one of your routine medications, if you miss a dose, just take it as soon as you remember. Now, this is not a blanket statement because sometimes you don't want to take two doses too close. So, depending on the kind of medication you're taking, if you miss a dose, you either take it immediately you remember or call your pharmacist, and then the pharmacist, knowing what the medication is and what type of medication it is, will tell you either to wait till the next day or will just tell you, okay, take today's dose and continue from, continue the next day just as it was prescribed. So in cases of missing of doses, it's always good to cross check with your pharmacist because they know what kind of medication you're taking and how, delicate is the dosing. So overcoming common barriers to adherence. The first barrier is forgetfulness. People forget whether they took did I take that medication today or was it yesterday? People forget. So that's why it's good to use reminders and pill boxes. You can get pill boxes very cheaply in pharmacies where you can arrange your pills for the week: Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday. Or some even have monthly ones where you can arrange the whole month. Another barrier to adherence is side effects. Some people, they take their medication and they don't feel good. Talk to your health care provider, talk to your pharmacist. There are different things that can be happening. Maybe if it's upset stomach, maybe it's something you should take with food. Sometimes it's instead of taking um, a very good example is metformin. Metformin is such a good medication for type 2 diabetes. But some people, when they start taking metformin, they have such upset stomach and diarrhea that they stop it. The thing with metformin is when you are going to start it for the first time, you have to start on a very low dose, maybe like 250 or 500 milligrams. Then also, we recommend that you use the extended release so that everything doesn't just come out in your stomach at once. The extended release will, over 12 hours or 24 hours release in your stomach so that you don't feel the upset stomach. So that sometimes if you have side effects, talk to the pharmacist, and then the pharmacist can talk with the doctor and suggest that you change to a different form of the medication. Some of the medications are coated, enteric coated, so that they don't dissolve in the stomach and they dissolve in the um, intestine, so that you don't have the stomach upset. So always call your doctor or your pharmacist if you have side effects, so that they can work with you on how to reduce these side effects or actually eliminate them. Cost is a very common barrier to adherence. If the medication the doctor is prescribing is too expensive, some patients decide not to take it or try to extend it to make it last longer. What should be done is try to find if that medication either has a generic or a generic alternative. So there might be generics that are not the same as the one prescribed, but they are an alternative. So you can explore that. Then some of the new brand names have like assistance programs. So the manufacturer might have some coupons that you can use which you probably have to renew every year, but still, that is a good way out. Now, what are tips for the caregivers to support medication adherence? So, if you're a family member, set reminders for your loved ones, then monitor the adherence and check for missed doses. And talk to the patient. Ask how you're feeling and how are you having. And don't ask just yes or no. Say how are you feeling with the new medication. You know, make them say things so that they'll tell you exactly how they are feeling and why they're taking it or why they are not taking it and how they are feeling when they take it. And then communicate anytime you go back to the healthcare provider, communicate with the healthcare providers about any issues that the patient is having. So that is module 4. Of course, it's just a very high level overview, but that is the module 4 on medication adherence. And for in-depth training, you can visit our school community, school.com/my web pharmacist, where you have a community and you can send a direct message to the pharmacist. So if you're attending the live um, workshop, this is where we have a Q&A. But even if you are just listening to the recording, join the My Web Pharmacist community and send me or the pharmacist who is there at that time, send us a message and we'll be able to answer your questions. So this is to remind you, this is My Web Pharmacist community bringing this course to you. So the next module is module 5. And there we're going to be talking about preventing medication errors. And we have the learning outcomes, recognizing common medication errors and how to prevent them, to develop strategies to minimize risk and ensure medication safety. And we're going to be having 4 topics: common medication errors, how to double check medications, preventing drug interactions, and knowing when to call your healthcare provider for help. So thank you very much. Remember to join the school community by web pharmacist, and there you can get access to a pharmacist directly. You send us a direct message. We'll also, for those who join, we'll give you a link to create your medication profile. And in module 5, we'll show you how that works. But if you join now, you get a link to create your medication profile, and it's yours, even whether you stay in our community or not. Okay, thank you for listening.